Thousands of Fairview health patients are scrambling tonight after Fairview says it's going to block access next year to its hospitals and clinics for seniors who have Medicare Advantage through UnitedHealthcare. That is a huge deal for thousands of people who deserve some answers. Here's Heidi.
Fairview Health Services is dropping UnitedHealthcare Medicare Advantage plans starting January 1st of next year. mHealth Fairview's chief medical officer says, quote, "We worked in good faith for years to find a sustainable path forward, but ongoing prior authorization delays, claim denials, and escalating complexity have made it increasingly difficult for patients to access the timely, high-quality care they deserve."
Have you already seen calls from people concerning this?
Yes, we have. Unfortunately, one of the challenges that we seem to face every year is beneficiaries calling us because they have received notice or have heard that their provider is no longer going to participate with their Medicare Advantage plan. And this seems to be a fairly common occurrence. And so it's a time of great anxiety for Medicare beneficiaries.
Kelly Jo Greiner is the Medicare product manager for Minnesota Aging Pathways, a free statewide service of the Minnesota Board on Aging.
The one thing we hear from Medicare beneficiaries time and time again is they don't want to have to change providers. Many of them have got established relationships with their clinics and their doctor.
Medicare Advantage is different from original Medicare in that they are private health plans that usually require their members to go to providers from their network. UnitedHealthcare says, quote, "We are committed to using the more than 6 months remaining on our contract to reach an agreement that maintains long-term network access to Fairview Health for people enrolled in our Medicare Advantage plans." But Fairview says the decision is final and there will be no further negotiations. Fairview sent letters about the change to roughly 35,000 UnitedHealthcare Medicare Advantage eligible seniors who have received care through them within the last year.
I would just tell them to wait. January 1st is a long way off, and a lot of things can happen during that time period. And they're really, to be honest, there's nothing that they can do right now because it's not open enrollment. And there's a lot of months left for things to work out. And we've seen this before with other plans and providers.
Oh, but it's still tough news, so we feel for everybody going through it. If you have any questions, if you're one of those people, you can call Minnesota Aging Pathways. They're formerly known as the Senior Linkage Line. It's a free phone number, 1-800-333-2433. They are there to help you through this. We'll be right back.